Hello everyone, how are you? Today we are going to review a case of a full class 2 treated with a combination of upper arch distalization and lower arch virtual jump in an adult patient. Let's go with the first plan. Here we can see that in this plan they are making upper sequential distalization of 5 millimeters in both sectors. Looked at from an occlusal view, they are moving molars and premolars in a sequential way, and they are retruding anterior teeth around 3-4 millimeters. We don't want this retrusion because if we retrude anterior teeth 3 millimeters in this case, we are going to reduce upper lip support, and we don't want to retrude upper lip because that will worsen the face aesthetic. In this case, we have to think in another way of solve this class 2. There is another reason. 5 millimeters of distalization are not predictable. Studies said that up to 2.5 or 3 millimeters are predictable, but 5 millimeters of distalization are not. And if you want them, you need to use auxiliary techniques as mini screws. The other problem that you can have if you do a distalization of 5 millimeters of molars and premolars is that there is no way to control the roots properly, so the teeth are going to tilt when you distalize them, and you're going to finish with a bad occlusion. In the treatment plan of the right, we can see that we are reducing upper arch distalization. Let's make a comparison between the first one and the fourth. Here we are distalizing upper arch around 2 millimeters, second quadrant less than the first one, because we don't want to deviate upper midline. And from these lateral views, you can see that upper distalization is not enough to achieve class 1. That is not a problem because we have this virtual jump tool. And why we have it? Because this virtual jump represents lower arch mesialization by class 2 elastics use. Look, using this superimposition tool, in yellow we have the initial situation of the arch. And normal teeth represents the final position that we want. And let's take a look now to the occlusion. This occlusion is better than this one. And on this side, the same. Look the difference. This is the result that we can have without elastics and this one with elastics used. There is a huge difference between the first situation and the final situation. We have too much overjet here, but remember that we are going to achieve a complete overjet because we are going to use class 2 elastics, and these class 2 elastics are going to retrude upper incisors because they are going to lose torque. This is something that we are going to see later. Let's continue with the virtual jump explanation. Here we have increased upper and lower arch expansion because with this expansion we can mesialize more posterior sectors without proclining incisors, and we add some IPR between lower incisors and canines to prevent this proclination too. And after all these modifications, we can mesialize molars around 3 millimeters, but we are going to procline lower incisors less than 1 millimeter. There is a better way to understand virtual jump. If you click here, you can see the movement during all treatment, and here looks how posterior sectors are mesializing without proclining lower incisors. Look, this mesialization represents class 2 elastics 24 hours a day for all those weeks. We are going to start wearing class 2 elastics from aligner 10 to aligner 37. If the patient collaborates well, you are going to finish with a similar situation that this one and this one. But if the patient doesn't collaborate, it's going to be a problem. And you can see that with this modification, we have reduced treatment time by 50%. Here is the situation that we have after finishing the first phase. After these 37 active aligners, we are almost in class 1 on the right side, and on the left side, we have more class 2, and we're going to distalize more this sector. And the other thing that we're going to do is to place midline elastics to solve this minimal discrepancy between upper and lower midline. We add some IPR to create a space, and this space is going to help to move anterior teeth and center both midlines. We also want to improve this posterior occlusion. With those attachments is enough. And if we finish this phase without a proper occlusion, imagine that we still have this minimum open bite. We can place some buttons on these molars and add box elastics or triangle elastics. It depends on what you get after this phase. And with those elastics, you are going to improve posterior occlusion. In this phase, we have 28 active aligners. That means around 7 months of treatment time. That is enough time to mesialize lower arch. But imagine that you just have 10 active aligners in this case, and you need to do more lower arch mesialization. What can we do in that case? We can change aligners every 2 weeks instead of 1 week. In this case, we're going to maintain the normal protocol of 1 week. But if you need more time for elastics use, you can double the time and change the aligner every 2 weeks. And with that refinement and with this refinement and that tip, this case is done. I hope that you like this video and see you in the next one. Bye bye.